Hello, everyone. Thanks again for joining us. And of course, thank you to the talented and very knowledgeable Mary Jean Cullen for joining me and our Tranquilli financial advisor for the third of three meetings in reference to Medicare. Today is about IRMA, IRMAA. No, not IRMA.
Today's about doing a drug review.
Oh, the drug review, right. IRMA was our last one. I'm sorry.
You have IRMA on the brain because of your client.
I have IRMA on the brain. Yes, thank you for that. So, corrected right in front of everyone. That's.
Do you want to start over?
No, that's okay. How's this? I am but a human, and my notes are not about that part. So let me just admit I can't get this wrong. My lovely and beautiful daughter, who I just asked to come in and wave to everyone. We have to send her back to work. Go ahead, Sarah. Wave to everybody. And go back to work. All right. See you later. There we go. So I just asked her to stop in because she sends out these emails, which everyone has me with IRMA on the mind. So Mary Jean, thank you again for joining us. As we have done in the past, we'll take about 35, 40 minutes to walk everyone through changing or reviewing drug plans within Medicare. A couple of things to note. We will send out the slides that Mary Jean is going to go through to everyone. We'll convert them from a PowerPoint into a PDF so you can reference them. And also the recording of this, and there was a second part of that. We are going to do a live demo of the Medicare site. So those of you watching after the fact, please be sure to watch that part of it. Usually we don't share screens or have many visuals, but in Mary Jean's case, I think it's really important that we do. And of course, her willingness to share the Medicare.gov site with us and review the how-to is much appreciated. So Mary Jean, with that, please, you take it away. I'll just ask questions as I have in the past along the way, and let's have a good discussion about Medicare drug plans and coverage.
Okay. Well, good morning, everybody. As you can see from the title page, we're going to use the 2022 Plan Finder for your plans that begin on January 1st, 2023. Okay. And the open enrollment period is starting tomorrow, October 15th through December 7th, you would have the ability to change your drug plans. And here's some information for open enrollment. First of all, this is the basic website where you're going to start off. And then this is just a little added on that brings you right to the screen that helps you to compare plans. And then if you have questions, you can always call 1-800-MEDICARE, and they're available 24 hours a day. So they're pretty welcoming for phone calls. Now, this is the homepage on Medicare.gov. They have done a fabulous job updating Medicare.gov. They made it user-friendly. That's got pictures. It's not so boring looking all the time. So they've really done a great job, and they keep improving it all the time. So kudos to those guys. This is the main page. And when you come to Welcome to Medicare, you're going to see right here, you're going to find health and drug plans. This is, and you would click on this to find them now. But what you need before you get started to make sure, of course, your zip code. I hope you remember where you live. The list of your prescriptions with the dose and the frequency, typically for a 90-day supply, because that comes out a little bit less expensive. What your pharmacy preferences are, although you may find that they may not be the most cost effective. Medicare account login information. If you have a Medicare account, which I recommend that you all create, it makes everything much easier for you, and you can see the drugs you take in there, the plans you're enrolled in. You can see your explanation of benefits. A lot of people get paper ones in the mail, but if you wanted to save a few trees, you could say, oh, you can send me paperless. And what they do, they'll send you an email that says, you have an explanation of benefits in your Medicare account. You can go look. Your Medicare card is in there. your other health or drug insurance cards. So it's really quite a helpful place to go. All right. So now I'm going to switch to the live system. A lot of the how-tos are in the PowerPoint, so you'll be able to use them later, but I wanted to show you how to actually use the system. So here we are at the page that I told you about. There's two ways you can come into the system. You can log in and create an account. So you could go in through your account, or you can just go to this screen here, which I'm going to show you. Find plans now. I'm clicking on that button. And then here's a place for me to explore. I can either enter using my account. So like it has a list of all your drugs you're on already. Some of them you might not be using anymore. So you could, take them out of the equation when you're pricing things. Or you may have new drugs that you want to add. So that's your choice. So you can go in and have it there. Then when you finish the work and save it, it'll always be there. Now, when I work with clients, I cannot do that because of HIPAA. I have to be very careful. I don't want to know your Medicare number and your logins or your private information. So when I do it, I like to do it once and done. That's why I might call you in the middle of it, because I want to make sure I have the exact drugs so I don't have to go in and out all the time. But it is possible to do it without logging in. So we have a choice here because I still have clients who are joining for November and December, but we are going to focus on next year's drug plans. So I'm going to put in a zip code. These are some I've been working on. I'm going to pick this one here. And then I'm going to pick a plan type. Some people, might be in a Medicare Advantage, and that's what they want to compare. But I usually go for the drug plan. This is where I go. And I hit apply and then start. Now it's going to ask me, do you need help with your costs? Do you get help from any of these programs? Because it will change the prices of the drugs in the system. Medicaid, SSI, Medicare savings programs, extra help. These are people who really have difficulty with their finances and they need these programs. But most of us are in this last category. I don't get help from any of these programs. Do you want to see your drug costs when you compare plans? Of course I do. Why else do you think I'm in here? So I'm going to click yes. Great. Okay. This is where we begin to add our drugs. So I'm going to add a drug. Someone will say, oh, I use Lipitor. And so I'll click Lipitor, add the drug. Now, if there is a generic available, they're going to tell me. So I'll say to the client, well, Lipitor has a lower drug. Do you take atorvastatin, or does your doctor want you to be on the brand name drug? And they say, oh, no, I take atorvastatin. And I'm like, gee, why didn't you tell me that in the first place? But some people don't realize the difference in the cost. So we're going to add generic. We can add the other if appropriate. And then I'm going to add, I want to get my dosage right in here. So let me just take a look at my thing because I want my screen to match your PowerPoint when you get it. All right. So this person is going to take, you click to see, well, what dosage? This person does take 40 milligrams. And of course, we want the best price. So we're going to put in, we want a 90-day supply that we're going to get every 3 months. And it's really nice because you can put in drugs for 2 months, 1 month, 2 months, 6 months, 12 months. So I have a person who uses face cream. She orders 1 tube a year. So I can just put in the tube for a year, and that's great. Okay, so you pick the time that you want. And then I add it to my drug list. And then I click, well, I want to add another drug. So my second drug is, this is the only thing I find irritating. I'll say, okay, my next drug. And I start typing in my drug and nothing happens. I wish they would just put the cursor right here because you have to click on the cursor to get back to put in the next drug. So I'm putting in bupropion. And here, it's right here. You always have to click on this. You can't just hit enter because you have part of it in there. You have to click on the actual drug. Also, if you're not quite sure, you can always browse through the drugs here, A to Z. But, pretty much most of us know what drugs we're taking. So this is the one I clicked. And this person takes they do take the 300. That's a common dosage. That's Wellbutrin is the brand name, and it's extended release. And then again, it's one a day. So I'm going to do 90 pills every 3 months, add to my drug list. Okay. So that's it for an example of how to add your drugs. So the next step, okay, we're done adding our drugs. Your zip code stays here. So it wants you to pick pharmacies based on that zip code. So those are the ones they provide. Okay. So if I don't see one that I want, I can always see this is 5 miles. I live in a pretty, crowded area to say. So, but if I say some of you live out in the Clinton area, you might need to put in 10 miles to get more drug plans or to see the mom and pop pharmacy that you like. But for me, 5 miles is enough.
Tranquilli is nationwide, Mary Jean.
Pardon?
I said Tranquilli Financial Advisors nationwide.
Nationwide, perfect. So, okay. So even if you're in California or Florida, you can, or Alabama, you can put in your distance so you can find the pharmacy that you wish. I always click mail order. They are not always the least expensive, sometimes, but not always. So, but I always click them because some people really like using mail order, and it's good to know. And you can pick up to 5. You can see there's 5 spots down here. You can pick up to 5 pharmacies. So I don't even know where this is in my neighborhood. I know the address, but it must be inside a doctor's building. But I have a CVS. I picked the easy ones, and Walgreens that are in my neighborhood. There's a ShopRite, there's a Walmart, Short Hills Pharmacy. And then I could pick the next screen if I want to see, let me try Costco. Okay, because I use Costco. So I'll put in Costco. I don't really need a 5th one, but I could if I wanted, Usually when I work on clients, I pick all 5 because then I like to eliminate based on cost.
And Mary Jean, if I can just ask a question here. In a past conversation, you mentioned Good RX, which I can let you know that a lot of people reacted very positively towards when you made that recommendation. Is that at all an option?
No, that is not an option in here. Okay. It is on, you put the app on your phone and you go to the drugstore and, or you can look it up ahead of time, of course. Say you do take atorvastatin and you go, gee, I wonder if I can get it less expensive through GoodRx. You just put in the drug, the dosage, and it'll give you the cost at each of the drugstores that are there. And then you can pick the one that's convenient for you or the one that's the least expensive. And then you show your phone, there's a QRC code. There is also, a number. It's like a coupon. It's like having a paper coupon in your pocket. And then they will use that and give you your drug based on GoodRx. There are others that I've heard of, but that is the most popular. But it's not to say there aren't others. I heard the guy from Shark Tank, Mark Cuban, he has something now. I don't know the name of it, but there are other similar things to this because they are trying to help people. Also, Amazon also has one, but if you want the Amazon pill pack, what's convenient about that is that it puts all your pills at the time of day you need to take them. So if you have someone maybe on a lot of medications, they can have pill packs made for them. They're a little bit more expensive, but say I can't find Amazon in here. Of course not, so I want to find another pharmacy. I'm sorry. Let me go back 1 second.
No, I appreciate it. I jumped in to ask that question just because, again, that GoodRx, recommendation was so well received. I thought it was important right here to find out if that is even an option, or any of the online options other than simply the mail order, which.
Yeah.
Okay.
All right. I'm going to go back. I know for Amazon, for their pill pack thing, it's a zip code like 03130, something like that. Okay.
Well, let's continue on.
We'll continue.
Maybe we can add that into the follow-up notes as well.
All right. So here we go. We have all our pharmacies that we want picked, and I'm going to click done. Okay. And it's going to take me to all the plans. There are 24 drug plans in New Jersey at this point for this plan year. And they're listed by, you know what? I have our faces, the view gallery over here. It's in my way. They're listed by the lowest drug and premium cost, because when you look for a drug plan, you are looking at the lowest overall cost. That will include the premium, how much the plan costs. It will include the cost of the drugs themselves at the pharmacy. It will include the deductible. And what else? There's 4 things. The drugstore that you go to. Okay. So it includes all those things. So I usually like to look by this, because I could look by the lowest monthly premium, but if they charge a fortune for the drugs I want to take, then what good is it? So this is the best way to go, to get the total cost for the year of what my drugs will cost. So here we go. This plan, Cigna Saver RX, came up first because if I go to a pharmacy, retail pharmacy, it will cost this for the whole year, including drugs and my premium. Or if I do mail order, it'll be a little bit less. The drug deductible for 2023 went up to $505, but most drugs in the tier 1, tier 2 category do not apply. It usually could be 3, 4, or 5. That's when the category applies for deductible. If I see a plan like this, Clear Spring Health with 1.5 stars, do not go there, skip it. So I'm going to click Cigna to save it. I am not going to pick this plan with a terrible star rating. 5's best. There are no 5s in New Jersey. Anything 3 or above is just fine. AARP Medicare RX Walgreens, they have 3 stars. They're more expensive, but I like to just pick just to compare, just in case. And then I usually do 3. So these are the 3. I might look see, here's a tricky one. Look, their mail orders lower. So I might pick this one. Okay. So now I'm going to compare these 3 plans so I can see, well, which one has the best prices? They're all 3-star plans. You can see the premiums are here. Here's the drug costs. Well, in this plan, Costco's out of network, so you're obviously not going to go there. But what I do is I look to see, this is the estimated total drug and premium. So look at this, $284.40 if I use mail order. That is my most cost-effective option. If I prefer a retail pharmacy, I can go to CVS, $297.20. Okay. So I'm looking at all these others and I'm going, you know what? CVS and mail order really look like the best deal. So what can I do? Oh, there's many things you can. So this is the main thing. You pick, all right, I think I want to go with the Cigna Saver RX. I'll get the best price. I can go to CVS or mail order. I'll think about that. And then I think, well, let me see, what are the details of this plan? I can click this button. So it's $13.80 a month. I can go to the website from here to enroll there, or I recommend enrolling right within Medicare if you need to switch plans from last year, or you can call them if you want. And then at the retail pharmacy, this will be the cost of the drugs. It does cover both. And if I do mail order, it'll be a little bit less. Okay, so my prerogative and my convenience. Then this shows the different pharmacies, who's in, who's preferred. Sometimes the preferred pharmacies, like Walgreens, is preferred, but it's not the least expensive. CVS is, right? Let's see. This gives you the price of the drugs, the total price of the drug. Oh, you know what? Wait. Yes, because even though Walgreens might charge you $0 for atorvastatin, they're going to charge you $191 for the year for the bupropion, whereas they charge $87 and $44. But it's the total that's important.
Good catch.
130. Okay. So I'm not going to go through all of this, but suffice it to say, there's a lot of good information in here. It shows you how much they cost at different times. If you click on this, it tells you about the tiers, like the general information about your plan. Atorvastatin is tier 1. This is tier 3. This is how many we ordered, we picked.
And
now people
brief tier 1, tier 3, if you don't mind. Just give me the
tier 1 is the least expensive. Those are preferred generics.
All right.
Least expensive. Tier 2 are generics, but maybe slightly higher. Tier 3 is a preferred brand name drug. Tier 4 is a brand name drug. Right. So they go up in price based on tier. Tier 5.
Preferred, that means that would mean to me or to someone reading this, preferred means Medicare would prefer that you choose that.
The plan would.
Okay,
the plan would.
Okay, thank you.
Because every plan has different tiers on drugs. I'm quite surprised that atorvastatin, tier 1, preferred generic drug, costs as much as it did further up on the screen. It's a tier 1 drug. It should be $0, But every plan is different. That's why it's a shell game. Okay. One point I do want to make, you see this, chemo, not covered. Other part B, not covered. Don't let this scare you. Most chemo or cancer drugs are covered under part B because typically you get injections in the doctor's office or at a facility. When a doctor provides the medicine directly to you through, fusion or infusion or whatever, those are covered by part B. So don't freak out if you see something like this. Okay. So this will give the details of the plan that you're picking. So we want to go with Cigna Saver. I'm going to go back to the comparison. So we see that one works the best. And I'm going to go back here. As of tomorrow, say you pick the plan now. You've picked your plan. Right here, tomorrow, there's going to be a new button that says enroll. So you can enroll in this plan right here. And what I like about doing that, you get a confirmation statement, which I recommend you print out and save. It proves that you did enroll. Very important. Because typically, say you go to the plan, to their website, and you enroll in their website, Cigna sends that information over to Medicare. Medicare goes, okay, we got it. And they send it back to Cigna. And then Cigna says, okay, you're enrolled. And they send you your cards and your materials. When you enroll on Medicare, it goes right into Medicare's system. They send it to Cigna. So you cut out a step. So it's a little bit faster and I think a little bit more secure in that you're enrolling right there and right to the horse's mouth, so to speak. Okay. So that is pretty much how to do it. Now, if you want, lots of times what I do, say currently I'm in the WellCare Value Script plan. So this is the least expensive. This I'd never put anyone in. This is next. And instead of picking, what I might do is I'd look for the WellCare Value Script plan. This is what I do. Here we go. Wait a minute. I want to get rid of Cigna. I want to get rid of this one. So I'm going to compare. So I put in someone's last year plan, just so I'm comparing the right thing. So if I look at WellCare value script, look, it's all in the 700s. Whereas I can get my drugs mail order $284. It's $400 more expensive. So you think to yourself, well, my plan only went up a couple bucks. What's the big deal? Oh, it is a big deal, because look what happened at the back end. The cost of the drugs went up.
And again, if I can just to ask, this is open from October 15th through December 15th.
December 7th.
All right.
Yep.
And don't just look at, let's say, the monthly premium. Make sure to go through this exercise, because as you're showing us with a mail order of prescriptions, you could be saving, I mean, literally thousands of dollars.
$400 in this example.
Wow. Okay.
Okay. Now you go, oh, the plan's only $9.30. Yeah, but that's not the whole story. Okay.
Look what's deeper than that. Sure. Yeah. Cheap doesn't mean right.
Right. That's why you need to pick the, so that's how I know, oh, this was what I was in last year. It would be better if I switched. Okay. And then starting tomorrow, you just go back in here and this will have an enroll button. You go ahead and you just go through, and it's easy. It's very easy. You know, you go into your own, you create your Medicare account. You have to have your Medicare account, and then you just enroll right through the Medicare plan. Now you can go to the website if you want, but, you know, and plan details. Here's the plan website. So I can go there and I can enroll right on their website. Or, let me see, our pictures are in the way. Our pictures are always in the way.
I moved the pictures over to the side view, but they're in the, sorry about that.
It doesn't matter because it's my screen.
Got it. Oh, that's
okay.
I have the biggest monitor in the world, so I can fit everything on here. It's a little.
Yeah. So anyway, there you go. Okay.
Excellent.
So that's it. That's how to choose your new Medicare plan for next year, and you don't need me anymore.
We all need you.
I'm putting myself out of business. I am.
You're doing a great job at it, and we appreciate it. Now, did we go through all of the slides that you wanted to share with us on the?
Yeah, pretty much. Because these. Oh wait, let me see if there's any at the end. One of the things, they talk about printing it. This is what I like to do. I do the plan details. I open up all of the, I probably would take Costco out because in one of them they're out of network. But if I want to see everything in this plan that gives me an idea of what my plan rules, these are the costs. These are my drugs. Star ratings, I don't worry about. They're definitely important. Like I said, 3 and above is fine. And these are all based, I usually don't open this up, but just if you're curious, the stars are very important because they're based on Medicare beneficiaries who have answered survey questions based on these 4 categories: customer service, complaints and performance, member experience, drug safety. And they all have different ratings, you can open that, availability, So it is important. And they are ratings given by actual Medicare beneficiaries. So, it might be nice to know, but I don't usually open that up just because too much paper. You can print this if you want, but say you want to print this. I usually just save them to my computer, but say you do want to print it. I recommend, you go to however you go to your print screen, but I definitely recommend that you make it a PDF. It'll print better. You can save this document to your computer.
Excellent.
When you print it, it comes out nice. I usually do double-sided, whatever you can do. And then you can either have a hard copy or you just have it in your system.
Okay.
But it's very handy to be able to print, but make it a PDF, because I learned this from a client. He's the one, I always have trouble when I just print. So I make everything PDFs. And I thought, you know what? He's right. And ever since he told me that, that's what I do.
That's good heads up. And I'll add to that. We are going to send your slides, as I mentioned at the beginning, in a PDF format. And if anyone would like to email me the PDF, once you've created it, I'll save it in your client folder and have it available to you, so that if next year when you go back in to review the prescription plan again, if you need a copy of it, we'll have it for you. You can send it over. So, Mary Jean.
One last comment.
Go right ahead, please.
If you do enroll, say you go back tomorrow and you do your review, and then you go here and the enroll button is here and you enroll. Remember, you do not have to disenroll from your previous year's plan. Medicare will only let you have one plan. So they will bounce you out of your old one. And then effective January 1st, you will see the new one, because it tells you what your current coverage is. And then there may be a line that says pending January 1st or something. I don't know, because I haven't done it yet. But you'll see you have your current plan through December 31st, and January 1st, it flips to the new one. So you don't have to disenroll, just one time. Okay.
Okay. Excellent. So the bottom line is prescription drug plan change opens tomorrow, October 15th, 2022. I want to mention to everyone that's here live and listening to this after the fact, Mary Jean has been nice enough to record 3 discussions on Medicare with us during 2022. If you would like all 3 of those emailed to you, I'll send links. If you'd like to find them before we email them or before you reach out to us, you can simply go to YouTube, search my name, Louis Tranquilli, and you'll find the 3 Medicare videos for 2022 on there that Mary Jean and I have recorded. This will be available, this specific on prescription drugs, within the next week or so. Once we have to produce it and everything and do all the things that the production people do as it applies to these videos. Mary Jean, I cannot say thank you enough. This has been a learning experience for me. This is not an area of expertise, which is why I'm so glad Mary Jean Cullen is here to share all of this with us. And of course, if anyone would like to reach Mary Jean, you can do so. Her contact information will be a part of the PDF that we'll send out with the email. And I'll just say thank you again, Mary Jean, for your time and expertise.
Oh, you're very welcome.
All right. We'll talk again soon.
Okay.
Everybody have a great day.
Bye-bye.
Bye.